During a normal IVF cycle, 1 or 2 fresh embryos are transferred a few days after the egg collection, and if there are any remaining good quality embryos, they are frozen. In elective freeze-all cycles, all the embryos created using IVF or ICSI are frozen so that no embryos are transferred in the fresh cycle. A few months later, the embryos are thawed and transferred to the woman's womb in what is called a frozen embryo transfer cycle. According to HFEA, elective freeze-all cycle is rated amber, meaning that there is completing evidence from RCTs as to whether it is effective at improving the chances of having a baby. And this is for most fertility patients. There is some evidence that the lining of the womb can be affected by the body's hormonal response to fertility drugs, something that makes the implantation of the embryo more difficult. Freezing the embryos allows them to be transferred to the woman when the womb lining is better developed. Although there is some research suggesting that frozen embryo transfers increase pregnancy rates compared to fresh embryo transfers, there's not enough evidence to support that freeze-all cycles are safer and more effective. However, for certain group of patients, freeze-all cycles have proved to be effective at reducing ovarian hyperstimulation syndrome. Finally, concerning the safety of the procedure, one should always consider the risk that 1 or more embryos may not survive the processes of freezing and thawing.